Tetralogy of Fallot. Tetralogy of Fallot is a congenital heart defect characterized by the presence of 4 specific heart abnormalities. These 4 defects are: ventricular septal defect, VSD. It is a hole in the wall, septum, that separates the 2 lower chambers, ventricles, of the heart. Pulmonary stenosis. This is the narrowing or obstruction of the pulmonary valve or the blood vessels leading to the lungs, reducing the blood flow from the right ventricle to the pulmonary artery. Right ventricular hypertrophy. Due to the increased resistance in the pulmonary artery caused by the pulmonary stenosis, the right ventricle must work harder to pump blood into the narrowed vessel. This leads to thickening and enlargement of the right ventricular muscle. Overriding aorta. In a normal heart, the aorta arises from the left ventricle and carries oxygenated blood to the body. In Tetralogy of Fallot, the aorta is shifted towards the right and partially sits over both the left and right ventricles, receiving blood from both, including some deoxygenated blood from the right ventricle. The combination of these 4 defects causes a mixed blood flow within the heart, where oxygen-rich and oxygen-poor blood mix. This leads to reduced oxygenation of the blood that is pumped out to the body, resulting in cyanosis, a bluish discoloration of the skin, lips, and nails due to inadequate oxygen supply. The exact cause of Tetralogy of Fallot is not always clear, but it is believed to result from a combination of genetic and environmental factors during fetal development. The condition can vary in severity, and the severity depends on the degree of obstruction of the pulmonary valve and the size of the ventricular septal defect. Tetralogy of Fallot requires surgical intervention early in life to correct the defects and improve oxygenation and overall heart function. The corrective surgery typically involves closing the ventricular septal defect and relieving the pulmonary stenosis to allow for better blood flow to the lungs. With timely intervention and appropriate medical care, many children born with Tetralogy of Fallot can lead healthy lives into adulthood.